The map on your screen shows the recently closed St. Margaret's Health in Spring Valley and Peru. OSF Healthcare is currently in the process of acquiring these assets, determining how best to provide necessary services to the Illinois Valley. Now, as we wait for more information from OSF concerning those locations, we're taking a look at the challenges of hospitals in rural areas. 13 WREX's Destin Howard spoke to the president of FHN in Freeport and the National Center for Rural Health Professions about the challenges of providing care.
Healthcare is essential everywhere, yet many rural communities face the challenge of keeping hospital doors open. Mark Gridley, president and CEO of FHN, a hospital in Freeport, says the limited number of people they serve does cause a financial strain.
Our demographics are slightly different as far as, who is making up our community. We also see different payers. A lot of times in rural communities, we rely really heavily on Medicare and also to an extent on Medicaid, which tend to be lower reimbursing payers.
In terms of providing access to care, staffing shortages are some of the president's top concerns, especially coming out of the pandemic.
During the pandemic was really a scary time for us, not only because of the physical challenges of what we were doing, but we were also losing a lot of money at that time because many of the services we had to close down, while at the same time our staffing and equipment were just getting more and more expensive.
The National Center for Rural Health Professions trains professionals to work in rural communities such as Freeport. Dr. Hannah Hinkle explains the program's efforts to combat staffing shortages.
It's all about growing your own and starting to work with communities, really across the state to identify students who have not just academic potential, but really a mission to serve their community.
Dr. Hinkle says federal laws also play a large part into the success of rural health care.
But it's also making sure that federally payment models are aligned so that rural hospitals, even though they're not seeing like the patient volumes in urban areas, are still able to generate reimbursement and opportunities.
I'm Destin Howard reporting for 13 WREX.
39% of Illinois hospitals are considered small or rural, and 52 hospitals in the state are critical access. That means they have 25 or fewer beds. OSF does have a phone line available for Illinois Valley residents. For more information on healthcare options, that number is 844-673-2778.